Good morning. This is Dr. Timothy Scott back here at LifePoint Medical, and I want to say good morning to you. And on this November the 20th of 2023, it is Thanksgiving's week, and I have a lot to be thankful for. I'm thankful for each and every one of you guys that shows up in my office and asks for help. I really am. It is what I chose to do with my life, and to be able to do it every day and to do it with good people who listen, and we work together and we make a difference in my life and your life, and all that good stuff is exactly what I had hoped for. So I'm very thankful for that, as well as thankful for my family, my community, my patients, my staff, just everything around me. I look and sometimes I am so thankful, and the best way to really be thankful is to think about it if it wasn't there. Okay, and realizing all the blessings that we have at this time. So speaking of that, since it's Thanksgiving week, we know Thanksgiving's on Thursday. We're going to be open Monday, Tuesday, and Wednesday, and we graciously ask that if you've got something you need done, if you need to be taken care of, if you've got medications that need to be refilled, you're getting sick and you're going into this long weekend, we want to see you. We want you to be seen and taken care of, so that you don't have to get sicker than what you normally would be. So again, we're not going to be open Thursday, Friday, Saturday, or Sunday, but we will be open Monday, Tuesday, and Wednesday. And if you call us, we're going to do our best to get you seen before Thanksgiving. I promise you, because we want you to be seen and be taken care of over this long weekend. So just keep that in mind. So I know you guys know that I went to a seminar a couple of weeks ago, Dave Ramsey, EntreLeadership and Master Series. So I just want to tell you that we're implementing a lot of the things in that program in our office, for the sole purpose of being able to take care of you better, happier, and just make it a better situation for everybody. So as we go through here, we first of all want to thank you for your patience as we go through this thing, but we are taking everything we do and we're going to figure out how we can do it better and accommodate you more and get you taken care of. And so hopefully you'll be able to see the fruits of our labor here shortly, with better service, more comprehensive service. I know a lot of you guys aren't complaining about the service we already get, and I really appreciate that. It's just, you need to know that we're back here in the background trying to even do a better job. Okay, so thank you for your patience. Thank you for your help. And hopefully we'll be able to take care of you better than you ever have in your life. On that same note, I just want to do one clinical pearl. Okay, so already this morning I've had a couple of reports of new cancers found on patients. So when I mentioned this to my staff and they were talking about what I could talk about on the video this morning, remind them that the annual wellness visits, which we do yearly, specifically address cancer screenings. And there's a few set cancer screenings that we know are effective, like the low-dose CT scan of the chest, like a pap smear, like a mammogram, like a colonoscopy, like a skin survey. We know those things are there to help us mediate our cancer risk. And the main time we pick those up and we put those in place is during the annual wellness visit. So again, if you've not had a wellness visit, or you think you're due for a wellness visit, or you want a wellness visit, remember it's a little bit different. We do things a little bit different during that visit, but the point of that visit is that we are totally 100% focused on doing the tests and the studies and the things we need to prevent you from getting sicker than you need to be, and try to keep you alive longer. And we know it works because we deal with the consequences of these things all the time. And maybe we find a new problem on a patient that was coming along that we didn't know was coming. Maybe we got to do somebody to do something the first time they ever had in their lifetimes. I know that we have intervened in very specific ways for lots and lots of people, and it made a difference in the outcome of their disease process in their life. So use this annual wellness visit as a tool to keep you alive, and we're cooperative with you. We're actually on the same page when it comes to that. And so we'll be calling you to set up annual wellness visits if you're not set up. If you think you need one and you don't have one, you call and we'll get you set up and we'll get you taken care of. Again, our main currency when it comes to that is lives saved. And we always get excited when we talk about people that we intervened in such a way that they lived a lot longer than they otherwise would have. This is Dr. Timothy Scott Beck. Happy Thanksgiving to you. Thank you for listening. Call us at 706-782-0016 if you need to be seen today, and we'll get you taken care of. Have a great day. Thank you for listening.